I had a funny feeling that I had cancer because I've been having cysts all over my breast since 1990. Ever since I came home, I had my mammogram every year done, and they would always tell me that I have fibrostic cysts.
When 64-year-old Rosalin Cruz retired from the Army, she came back home to Guam. As recommended, every year she went for a mammogram test. Cysts were found, but none of them proved cancerous until last year.
They discovered that I had a cyst on my right breast actually in 2014, but it was really tiny. And then when I went for my mammogram, they said that they need to do a biopsy. So when they did, it was in like November, December timeframe
Of last year.
of last year.
The biopsy came back positive. This time, the cyst was cancerous.
Actually, in reality, I just continued going and praying and hoping that, but then when reality hit, I was by myself when they gave me the news. I expected it, but I was numb. I wasn't sure if it's really the truth and all that. I had fear. I was afraid, but then I came from a Catholic family, and my mother taught us to believe and trust in God. So I put my faith in Him, and that's what's been holding me up.
A military veteran, Cruz had her cancerous cyst removed at Naval Hospital. Then, the Veterans Administration office in Honolulu referred her to GRMC's Radiation-Oncology department. Jeff Corwin is GRMC's radiation therapist.
We are state-of-the-art. We have a wealth of experience, and the process itself, though it might seem daunting, is really very simple. We make it very user-friendly, and it's very comprehensive. We don't just attack the disease, we'll help you navigate the entire process.
Beginning in mid-May through the end of June, 5 times every week, Rosalin arrived for her treatment with GRMC's linear accelerator.
They set me up where where I cannot move and all that, and during the time frame of the radiation, which is not very long. It's just a few seconds on each site.
By the time we get to this point where we're treating every day, this process is essentially done. It's just like, I tell my patients all the time, think of the radiation treatment just like taking a pill. The doctor says, I want you to have this much of this medicine every day. And you take your pill every morning like you're supposed to, voila. The real hard work happens before we ever do that first treatment.
They have this, it's like a headrest for me, and they do all the measuring and all that to ensure that it's the same measurement every day, and no difference. The only thing, I can breathe and all that, I just can't move. So.
We've got a fellow, he's a dosimetrist, and we've got a physicist who plan this treatment to a 3-dimensional volume with a margin of error that's millimeters, teeny tiny. We are so precise that we can spare almost all that healthy tissue around, which of course minimizes side effects. Once we've actually got her lined up, we step out of the room, and the machine has already got the prescription, everything. All the planning is all done. And so all we have to do is just come out, and the machine tells us what buttons it wants us to push, everything. It's all very user-friendly, very simple. And then the buzzing sound is actually just the radiation being delivered.
Well, there was a couple of times that I was, when all those big machines were moving around, I said, okay, what's going on, And I just lay there quietly and waited until they were done. But as far as the treatment is concerned, the machines and all that, it's painless, you just lay there and let them do the work.
How long does it last?
Like on one side, the minute I hear the machine kick in, I start counting, and the most that I have counted too was like maybe 28, 30 seconds on one side and 23, 24 seconds on the other side. So it's less than a minute.
You don't
know.
feel any pain
No,
and no discomfort?
no.
So if I'm about to undergo that treatment there, and I'm afraid, what do you tell me?
I'll hold your hand and tell you that it's okay, you know.
We have the capability to treat much more focused. We can do the treatments much more quickly, meaning you're only on the table for a couple of minutes. It used to be you were around the table for a half hour, 45 minutes sometimes. Now you're on the table 10 minutes. I come from a large volume facility in downtown Chicago, and even we didn't have a machine like this.
Recommend that they would come and see these people here because they are very helpful. They go out of their way to make you feel comfortable and give you whatever services that they can offer.
We're using x-rays, just like they take a picture of a broken bone. We're using the same kind of radiation, just much more powerful. But you don't see it, you don't feel it, you don't smell it, you don't taste it, nothing.
Nothing to be afraid of.
Exactly, absolutely nothing.
The treatment lasted for 6 weeks. It's now over, and Rosalin Cruz is a survivor because the cancer was caught early.
It's very important. I tell my nieces and everybody to come in early to make sure that, and it's very important to, you know, to get their mammogram done every year.
Early detection is important for everything. This is exactly what we hope to see for a breast cancer patient, really early stage.
I have another day to look forward to and all that, and to ensure that the cancer doesn't come back in my breast.